So doing jiu-jitsu and all that stuff, and I never really.
Well, between
off.
14 years of law enforcement and military plus,
Yeah.
and then, you know, legitimately actually having hardcore surgeries,
Yeah.
you know, your body has literally changed a little bit. So, you know, we talked about the bicep tendon and the tendinosis and all the other stuff again, but essentially if you're taking a bone or I guess you can say a muscle or a bone or both, and you're essentially reattaching it from here to here or wherever you're moving it to, at this point in time, your bicep, the inside or the short head or the medial head, that was fine. It was actually like maybe a 4 out of 5. Not strong as I'd like it to be.
Okay.
Definitely the long head, like out here. It's also more vulnerable for your shoulder out here, right? Because it's harder. You have to use more shoulder to externally rotate.
Okay.
But at the end of the day, like I just tested every single rotator cuff muscle. Compared to your left, super strong on your left, not as strong on your right, with highlights on teres minor, which is this one, the subscap, which is this one, and the bicep.
Okay.
Then I tested you for, so the bicep, just so you know, it becomes part of the labrum. Okay? So here's the bicep. If we follow it all the way up, it'll attach to become part of the capsule, and it, let's get rid of the bones real quick. The muscles real quick. We get rid of these bones, and here's where the bicep tendon actually becomes the labrum here. So the labrum is that ring of cartilage that you probably already know of that creates a lot of stability for our shoulder joint.
Is that what gets inflamed maybe from doing this motion here and then causes that numbness?
I think the numbness is probably something else. I tested you for something. It didn't come up positive, so I think we have to keep treating and searching and treating. Yeah. I think that's one of the things. So let's kind of, I'll try to make a full circle on this. And so basically, I tested the labrum. You had some popping and clicking. You had some pain. You had some weakness. I don't know if you had a labral reconstruction. I don't know. Maybe you'd have to go find the actual surgical report or whatever. If you do find it,
I think I have it at home.
Shoot me an email to it. I'll be happy to take a look over it because I think that can help me help you with your rehab.
Okay.
But I'm going to assume there is until proven otherwise. That also tells me, based off of our orthopedic testing, I think you had stability in there, meaning it's not going to pop out, it's not going to shift out, but I think it's so looser. Like imagine taking like a soda can and just like breaking the seal, but it's not completely, like the plastic's not breaking. So it's like, it's stable, water's not going to come out, but it's not airtight anymore. I think that's what's happening with your shoulder at this point in time. Every single test I did to test the labrum itself came up positive for pain and or dysfunction and or popping or clicking. It was one of 3 or 4 that I'm looking for.
It was weird the other day. I think I was even washing my hair and I just felt it kind of like drop and I was like, ooh.
Yeah, I don't know if it's going to create more instability. I don't know if it's going to create less instability. I don't know how it's going, but I could tell you that if it was my shoulder, I don't like the way it's going right now, based off of that. So there's a lot of weakness in a lot of different areas. There's a lot of immobility in a lot of different areas, and weakness can cause more issues, which you already know, and lack of mobility as well can create more areas. But I think there's a lot of weakness that needs to be addressed too. When it comes to shoulder issues, when somebody's reaching, which you have, or doing anything like that, they'll start doing this. They'll start using these cervical musculature, or all the muscles, including the upper trap, the levator, all these other shoulder girdle muscles, to start moving the shoulder blade, and as opposed to using the rotator cuff properly. Because you're not using these muscles properly, all this other stuff around it has to start working a lot harder. So I would assume that the nerves that pop out of there are getting a little pissed off because all these muscles are creating a lot more friction than they freaking need to through that area, causing that numbness and tingling. I did, on the other hand, test to see, like, if you kind of pull down the arm, I'll do it on the side just for a second. Like, I did pull down all the nerves on each side doing these weird tests.
Mm-hmm.
You felt a little tension, but nothing that truly was positive at that point in time. Same thing was true for your lower back. I pulled down all the nerves around the back on these areas. I'm trying to piss them off. I'm trying to get them upset. They're not upset with you, so that's good. I actually think you have, like, a lot of SI joint compression and lower back compression, like, right through here.
Because I notice when I run for a good distance, this leg will start to go numb, and I'll get, like, dead foot. It'll start to feel like it's flopping almost.
Do you feel like what we call a heel slap? It goes...
Yeah. Like, I feel like, my wife even tells me, she's like, you want to put a limp. Like, it's weird.
So, that's a pretty aggressive medical thing that we may need to take a look at. If you do have that, like, you need to go see someone too.
Okay.
Like,
that's where they did that MRI, and that's where they found out that I had that pinched nerve.
When was that?
Oh, that was probably 6-7 years ago.
Because you're far away from where I live and where I operate my office out of, I mean, you should err on the side of extra caution.
Okay.
Not because I'm trying to scare you. This is how I operate in just life in general. I'd rather be overly concerned and wrong than be obscurely negligent and wrong.
Right. Oh, yeah.
You know, I would just rather care too much and say, he sent me for something that I didn't really think I needed. But I also wouldn't give you that recommendation if I didn't think it was, like, in line or closer to that style. Because if you're getting numbness and tingling, you're getting enough vertical compression down to the disc that it's causing enough direct compression to that area. And what if you just, like, have no, like, let's just say you look at the MRI and there's no compression, but then you have more of a functional thing, like, after all that jarring, the surfaces are coming together, and then you're pinching that nerve at the end of the run, and then the run goes away, and you stretch out, and you feel fine, and like, that's what I think might be happening.
Yeah, they said that. I guess then it would start to restrict blood flow, and then I would start to lose muscle mass.
Yeah, but you haven't done that yet, and also I tested you on a lot of that stuff, and you came up negative.
Okay.
So, you know, I'm only just erring on the side of caution because you're not here.
Okay.
And you're like 2+ hours away, depending on how fast you drive. But these nerves go all the way down to the leg, as you can tell, and I tested all the different distributions, shooting out this way, in this direction. That's what me doing all these weird this, and then bringing it across and then doing that was weird. And, like, everyone's like, nobody just stretches my hamstring like that. Everybody thinks it's a hamstring stretch. It's really just me testing all the different divisions of the nerves to see if I can piss it off.
I notice when I'm on my stomach, I'll be laying on my bed, and I'll bring this leg behind me. I'll feel like a popping back here. I don't know if that's...
when you bring your heel to your butt, which is what I did, that actually irritated. What that does is that drops the L3 into L4 into a little bit more of extension, and sometimes people get a little irritation back there, or it can irritate some of the SI joint area. I think you just had a good amount of compression from that military jump, and then ever since then, you know, so keep a watchful eye on that, especially if you have a pretty physical job, and if it's not physical, probably also sitting down an excessive amount of time patrolling.
Yeah.
You know, if it's crazy to think that, and if you think about your job, you can go from extreme, like, you can, let's just say you have an 8-hour and 30-minute shift, right? You can literally go around from, like, stopping nobody, hanging out with nobody, doing nothing with just nobody for 6 to 8 hours, and then you can have an all-out pursuit where you're chasing after somebody in an all-out sprint after sitting for 6 hours.
Yeah.
I don't know about you, but last time I saw, like, an Olympic runner, they, go out for an going for an all-out sprint, they had adequate warm-up time. Yeah. You know, but people don't think about it like that.
And then having all that gear and...
Yeah, I mean, that's what radios are for, right?
My wife's like, you know, you're not 20-some years no more. I'm like, yeah.
So I think, you know, the numbness and tingling could be as a result of maybe the radial nerve. I will say that I didn't find anything in there, so it's probably as a result of something from here up going on as a result of you overdoing that. So the good news is that's part of the shoulder and the scapular and that girdle. So we're going to be working all the way through this whole area anyway. Does that all make sense to
Yeah,
you?
yeah, yeah.
You got any questions for me?
No.